Now, Humanitarian NGO Gift of the Givers is optimistic the fourth wave won't be as harsh as previous waves of COVID-19. To explain why the organization believes this is the case in the face of rapidly spreading infections, I'm joined now by its chairperson. Let's welcome Dr. Imtiaz Sooliman. Dr. Sooliman, good afternoon. Thank you very much for your time. Your sense of optimism is driven by what factors? What are you seeing on the ground?
Good afternoon, Dan. It's more by what I'm not seeing on the ground. It's in the first three waves, we were getting flooded with calls. When the fourth wave hit and the numbers started rising, we were expecting calls to pour in from CEOs, from medical managers, from hospital staff in general, from Gift of the Givers teams stationed all over the country in various hospitals, from the public sector, from those who lend out oxygen concentrator machines, from ICUs. Not one call since the 24th of November till today. 24th was the day that it was announced that the new strain was detected in South Africa and identified. From that day till today, not a single call. And yet, in the three strains previous to that, we were flooded with calls, virtually, without exaggeration, thousands of calls. People would call from the public, family members, late at night, 12 at night, 2 o'clock in the morning. All my team members will be woken up in the early hours of the morning. We need oxygen, we need machines, we need oxygen. Please, can you help? Not a single call, which tells me that whilst we have thousands and thousands of cases, and the number is probably much higher than it's recorded because many people still don't test and many people are asymptomatic. And with all those testing, we haven't had the level of admission, in a hospital, but more than the level of admission, the level of deaths, because a lot of people died without admission. They died in their homes, they died in their cars, they died in the casualty, in the car parks. Many people, especially in the second wave, died outside hospital, and we haven't seen anything to that effect. And the other way of measuring it, the number of funerals. If you check with the funeral parlors, it's substantially low in this wave.
Now, what you are seeing, or what you said, what you are not seeing on the ground, indicates that perhaps in this fourth wave, despite the new Omicron variant, the level of aggression is not the same. Therefore, there's not much severe illness going around.
Yes, it's very much transmissible. People are getting infected faster. And, it goes back to the time in the plane. Those people that went to Netherlands and that was stopped on the KLM flight. 12 hours before they left, nobody was positive. Everybody had a negative test. And about 12 or 13 hours later, there's 81 people positive. How did that happen? Did this thing, somebody became incubated and became positive and spread to those people very, very fast. And even in hospitals, in the morning, I'm in touch with a lot of hospitals. And the CEO will tell you, I had 12 staff positive this morning, and suddenly she tells you it's now 30, and then she tells you it's 50. It's within hours it's spreading. In events, people are going, even at the RAGE event, at the ICC, there was the ICASA event, you find that within a short space of time, the number of positives increase. So yes, the rate of infection is very much higher and very much faster, but the severity of the infection is not there. I'm sure, I don't practice medicine anymore, but I'm sure those physicians doing the blood markers don't see the type of blood changes that we've seen in the other three cases where the blood changes were very, very severe. In this case, it's even milder than the flu. Most people we know recover within 2.5 days.
Now, what are the lessons here? Because, there's still uncertainty, but what you are seeing is the reality on the ground, as you so eloquently painted the picture for us, Dr. Sooliman. But there could be some lessons. We can't really sit back and relax, because the last thing we do need is something else coming up from the left field and putting pressure, for example, on hospitalizations.
Complacency. The biggest disaster is complacency. We can't take a chance. Because what's worrying me is, why are there so many positive healthcare workers? Most of them have been vaccinated, and most of them I spoke to have been vaccinated. Some have taken booster doses, and some of them, or many people, have been ill previously. They've had previous COVID. Yet they're positive again. So either, the strain is very, very unusual. Alternatively, people are not wearing their masks. People thinking they're vaccinated and they're safe, which is not true. Yes, you may be safe from severe illness, you may be safe from hospitalization, you may be safe from ICU, but you are not safe from being infected. And you are not safe from passing the infection to fellow healthcare workers or to your family members. So the standard rules that we had, we still have to have the social distancing, the masking, the washing of hands, the cleaning of hands, sanitizing, and of course, ventilation. We need to have lots of ventilation to make sure, especially now, when people are not going overseas anymore, and I encourage them to do local tourism, support the economy, support local jobs. But when you go out to restaurants, preferably eat outside. do everything outside as far as possible. Do outdoor activities more than indoor activities, because that's the best safeguard for you. Yes, you may not get so sick now, but the chances are if you slip up somewhere and get into the habit of not being safe, you may get hit by a next wave which won't be so friendly.
Yeah, you are a medical doctor. Before I let you go, I need to ask you this. What you have observed, would it justify a change in the level of restrictions from level 1 to a higher level when the National Coronavirus Command Council meets with the President?
No, it makes no sense. The testing labs are showing that the virus is all over the country. What are they going to do? Lock the virus down with the people? It's not going to work. All the labs are showing high numbers of cases all over the country. So the virus is all over the country. You just see the beaches, what it looked like in the weekend. It's all over. It's spread all over. As it hasn't gone to the Northern Cape. It's too far for it, I think. But, it's everywhere else. So it doesn't make sense to do that. And you have to balance that off with the economy. Are you going to achieve anything significant by locking down where there's not severe infection? Yes, there's a number of people getting infected, but hospitals are not compromised. They're not pressurized. There's no issue there. And you're going to knock out more jobs, which is going to be a more difficult thing to sort out. I would be dead against going against higher than level 1. What I am for is that the extra 150 billion rand that the finance minister has now, Mr. Enoch Godongwana, should put that in putting more healthcare workers in hospitals. We have a terrible shortage of healthcare workers in hospitals. What these healthcare workers who are now maybe asymptomatic, but still they have to be isolated. They're positive. They can't go and touch patients because the patients will get scared. So it's not fair for positive workers to be near patients. Yeah. But at the same time,
sorry, Dr. Sooliman, just to come in there, are you calling for, so to speak, a concerted drive to employ more healthcare workers on an interim basis or on a permanent basis to close the gap that's being left by those who are currently sick?
No, permanent. This is the call I made on the first day. Because remember, we were the only country virtually that went on a lockdown when we had no wave. On the 15th of March last year, the president announced a national disaster. On the 27th of March, before our wave came, we went into lockdown and caused a massive catastrophe in terms of jobs and lockdown. And we were told the lockdown was being put into place to prepare the hospitals. What preparations were being done to prepare the hospitals? There were no additional staff put in hospitals. There were no additional oxygen points put in hospitals. And the hospitals were already severely compromised with a shortage of healthcare workers before COVID came. And then of course we got hit by COVID. More than 1,000 healthcare workers have died. And now thousands are infected right now. And we don't have replacements. Even they were dilly-dallying, putting junior interns to work. I think it finally happened in the last 48 hours. You can't be dealing with things like that when you're dealing with people's health. You have to have workers to deal with the country, and COVID should tell you that your biggest investment should be in healthcare and especially in personnel. So to answer your question, we want permanent healthcare workers, doctors, nurses, paramedics, physiotherapists, and especially a lot of psychologists, because mental health has become a huge problem right now with the anxiety with COVID-19.
Dr. Imtiaz Sooliman, thank you very much for your time and your very clear message there. Any lockdown, any further restrictions won't resolve anything. He's, of course, the founder of the Gift of the Givers. Currently, they're noticing a lot of infections. It's all over the country, especially with this Omicron variant, but illness is not severe. There is no pressure on hospitals. So why you want to lock down the economy? Very good point there being mentioned there by Dr. Imtiaz Sooliman from the Gift of the Givers.